Another surgical procedure we'll be looking at is the balloon angioplasty. Now, trying to understand this word from the first principle, well, balloon is balloon, okay? Then angio has to do with your blood vessel, okay? Then plasty should be something like plastic, okay? So you just have to do with you are trying to widen the blood vessels, right? Balloon angioplasty. You are trying to widen the blood vessel. You initially put the stent with the balloon. You don't inflate it, okay? Then later on now, you now inflate it, and the balloon around it has some things like some rough things, okay? So not really, okay? So those rough things is a stent. You might choose to place the stent, or sometimes you might just choose to what? Grade off the fats that are actually what lining that blood vessel, and then remove it, okay? So that's what the concept of this balloon angioplasty means, all right? But let's look at it. Let's talk in depth on it and see how we can make progress. We're saying balloon angioplasty is a minimal invasive procedure, and it is done to widen a narrowed or blood vessel that is getting blocked, okay? And you are using a balloon catheter. You put the catheter with the balloon. It's after you put it there, you now inflate it, okay? So as you inflate it, you can place the stent, or you can just choose to what? It's just like you are washing a pot with an iron sponge, okay? You might choose to just wash the blood vessel, okay, remove the fat, or you might just choose to leave the stent, okay? So what are the types? We have the peripheral angioplasty, we have the coronary angioplasty, we have the carotid angioplasty, we have the renal angioplasty, we have the iliac angioplasty. Indications when you should do this type of procedure. If the patient is having atherosclerosis, what is atherosclerosis? Atherosclerosis is the deposit of fat plaques, okay, on the walls of the vessel. Okay, if there's peripheral artery disease, if there's coronary artery disease, if there's coronary artery stenosis, if there's what renal artery stenosis, okay. Procedure: first of all, you access where you want to go, okay, which part you want to actually do this surgery. You now insert the catheter and the guide wire. It's after you insert that you actually inflate the balloon, okay. So you inflate the balloon, then you now place the stent. I told you guys that stent placement is optional. Sometimes you might be doing it just to break or lyse a thrombus, or just break down the fat or stuff, right? Or sometimes you might be doing it to actually place the stent, okay? Then you now close the access site. Techniques, okay? There could be a balloon angioplasty alone. There could be stent assisted. That's when you are placing a stent. There will be cutting balloon angioplasty. There could be cryoplasty, okay? Now, moving forward, what are the complications? Of course, a surgery is a surgery, whether it's minimal invasive, right? There's a risk for bleeding and infection. Whenever they ask you for complications of any surgery, bleeding and infection should always come first, right? There could be restenosis, where the thing is reoccurring again, okay? There could be vessel rupture or dissection. There could be allergic reactions. Okay, so that's it for balloon angioplasty.